Given the adverse conditions arising from the COVID-19 outbreak and the unprecedented spike in new infections during the second wave, swift responses and effective management have emerged as paramount safeguards. The latest success story that has managed to inspire confidence amongst the people is that of Uttar Pradesh. Being the most populous state in the country, Uttar Pradesh had the responsibility of initiating and managing one of the most challenging circumstances, particularly with heightened infection rates and requirement of medical oxygen during the second wave. Safe to say, not only has the state government effectively managed the situation through a pragmatic and result-oriented approach, its efforts have received appreciation from the World Health Organization as well. But how was UP's management different, and what were some of the factors that contributed to its success? The state government led by Chief Minister Yogi Adityanath adopted a preemptive approach. Realizing the heightened need for medical oxygen and an almost critical requirement in treatment, teams were mobilized on war footing. Moreover, innovative steps ensured that no unnecessary time is wasted and supply chains are streamlined. By establishing hubs to augment regional supply, it was possible to further stabilize and ensure adequate supplies to healthcare facilities and avert any shortage. The proactive steps coupled with the commitment towards public welfare, the oxygen lifting capacity was increased by almost 300%. All this while simultaneously ramping up production capacity by installing PSA oxygen generation plants with the help of the Prime Minister Modi-led Government of India. While managing the crisis in the cities, the UP government also launched an aggressively testing campaign in rural areas across the state. Following the test, track, treat strategy highlighted by Prime Minister Modi, the Yogi Adityanath-led government deployed teams for door-to-door testing in the state's many villages. All symptomatic individuals across these villages were tested and informed about the isolation and quarantining. Medical supplies also shared during this massive exercise, which has earned the support of even the World Health Organization. Thirdly, strengthening the existing healthcare infrastructure was also one of the primary challenges. One that too was handled expertly. By augmenting healthcare centers across urban and rural areas, an all-response has enabled a dramatic increase in capability. Preparing for the high demand for beds, the state administration has also added a significant numbers of beds in short time span. These facilities are in addition to the new developments happening across the region. Take, for example, the one of its kind COVID Integrated Command and Control Center in Varanasi. Finally, vaccination is another area where the state has done remarkably well. The state has administered over 1 crore doses of COVID-19 vaccines in a tremendous achievement. In fact, UP also became one of the first states to place orders for vaccines independently, as well to float global tenders to make vaccine easily available. What's more, the list of documents required for vaccination has been extended to ensure that even non-permanent residents are not left out. All this, of course, will be done by the state government free of cost. A combination of these measures coupled with a positive and problem-solving approach from the state government is reflected in the graph for new infections that continues to show a downward trend while recoveries are on a rise. If this success can be replicated in other states across the country, controlling the second wave of the pandemic may very well be in sight. Until next time, keep watching New India Junction and don't forget to like and subscribe.